One of our specialized treatments is that we do trigger point dry needling. It's a way to take away some muscle tension that soft tissue or hand mobilizations can't get to. It uses a microfilament needle to go in and release those muscle knots. The dry needling will go in and insert directly into where the knot is and kind of help release that muscle. On the counter side, we can actually wake a muscle up with the needle. So some people have problems with chronic low back pain, and what we want to do is we'll take the needle and find the multifidi, which is a local stabilizer of the spine, and inject the needle or put the needle in there, and then we can turn it on almost. So dry needling is great for a bunch of different reasons. It's not just to release a muscle. Other injuries though that we use it for are muscle strains to help rebuild the muscle, because you want it to heal properly, not just in a scarred way. You want it to heal in a nice way. We needle anything from head to toe. So for headaches, we can treat up closer to the skull. We can go anything down to the feet. Most people, when I say needle, they're terrified and they're like, "You're gonna do what?" So I try and explain to my patients that it's not an injection needle, which is a hollow tip and it's gonna hurt. Ours are cone-shaped, and so they're designed to push fibers and skin cells and cells out of the way versus pierce them. So it's much more comfortable than people think of getting a shot or an injection. They also are very thin, and most people don't even feel them going in. When they're in there though, they might feel the contraction of that muscle, because as the needle is releasing it, the muscle's stuck in kind of a semi-contracted state. So when we insert the needle, what we're trying to do is send it through a full contraction so then it can go through a full release. So I recently had a patient who had chronic hamstring pain. It's been going on for several years and tried multiple avenues of even physical therapy before. Her and I decided to try dry needling, and within 3 sessions we had gotten her back to full hamstring extensibility. She was not able to touch her toes for a while, which is a big important part of that flexibility being in her job, and with us being able to restore that, it greatly helped her be able to return to her job and help her help other people.